Good morning, everyone. Welcome to this episode of iPros TV. My name is Cristian Gallardo, VP of Sales for iPros Insurance Professionals. And today in the studio, we have Jezabel Yrbina. Sorry, I mispronounced that. They're here to talk about a really important topic that's going to be affecting you and your clients this year, redetermination. So really excited to have her in the studio today to inform you all about how it's all being rolled out. Yrbina, the stage is all yours.
Thanks, Cristian, and thank you to iPros for having me here. I really wanted to make sure that the broker community is very educated on something that's very important right now. You'll be hearing a lot about it, redetermination. It's already been 3 years since the public health emergency first started, so nobody was going through redetermination, and now that it started, there's a little bit of a frenzy going on. So I wanted to spend some time to talk about it. So let me go ahead and share my screen. So let me go ahead and get started by explaining a little bit about what SB260 is. So state law enacted due to SB260, it really authorized Covered California to automatically enroll consumers into a qualified health plan if they were to lose their Medi-Cal coverage. So if we recall from before SB260, if somebody on Medi-Cal went through redetermination and they did not submit their documents, they were essentially dropped from Medi-Cal coverage, so they were left uninsured. So what this program aims to do is make sure that members who are no longer qualified for Medi-Cal are able to transition so that they can still retain health coverage. And Covered California first began its auto-enrollment program for consumers transitioning from Medi-Cal on April 1st. So that was actually the end of the public health emergency and when redetermination started. Now, keep in mind that redetermination started for approximately 15 million Californians. So, there's a lot of Medi-Cal beneficiaries who have very limited contact with DPSS. So it's very possible that they don't have their current information. And if DPSS is not able to send them information regarding the redetermination, I think that it's really up to us if you have, contact with beneficiaries to really call them and educate them on what they need to do for the renewal process. Now, June 30th is going to be the final day of Medi-Cal eligibility for this first group of folks who are going through redetermination. So at that point, anybody who does not submit their redetermination paperwork or they no longer qualify, that's when they'll be turned from coverage. Now, if somebody is no longer eligible and they do transition successfully to Covered California, the earliest possible effective date will be July 1st. Now, L.A. Care has estimated that approximately 300 to 330,000 Medi-Cal recipients just in L.A. County alone are going to be ineligible for Medi-Cal due to the redetermination. So, as I mentioned, SB 260 does require Covered California to automatically enroll those individuals. Now, beginning on July 1st, the members are going to be transitioned into the lowest cost silver tier Covered California plan, which for Los Angeles County is LA Care. But there are some nuances there that I'm going to explain in the following slides. Now, here's a very brief timeline on the renewal month. So keep in mind that not everybody is going to be going through redetermination at the same time. Okay, so everyone has a designated month that they go through their redetermination. That will still remain the same. So this first group of folks started in April, and it will continue on until the end of June. So the first group is during this time in April, DPSS is going to initiate ex parte renewals. Now, for those that are not familiar with the term ex parte or what ex parte really is, it is a process by which DPSS can verify income information for Medi-Cal beneficiaries. So for those of us who also sell Medicare and work with the dual population, you may notice that a lot of those duals, they automatically have their Medi-Cal renewed every year and they don't have to go through the redetermination. That's probably because they're on SSI or there's disability income that can be verified by DPSS through their system. So that would mean they don't have to submit the documentation. Okay, so for those folks that are not able to have the information verified by ex parte, which would be everyone else, they're going to get a little yellow envelope in the mail. So if you hear somebody contact you and say, I got a yellow envelope, that's what it's referring to. It's the redetermination. Now, by June, if DPSS has not received redetermination information, they'll send a notice of action 10 days prior to any adverse action. Or they're also going to send this if they did complete the paperwork, but they're found like their income no longer qualifies them for Medi-Cal. Now, on June 30th, that's when the Medi-Cal coverage will be discontinued for folks who either no longer qualify or they never submitted their paperwork. Now, this next slide really does just outline what that auto enrollment process looks like. So I do want to mention that probably the messaging is a little bit confusing because when you hear the term auto enrollment, the first thing that may come to mind is it's automatic. You don't have to do anything, and that's not the case. So this is why it's so important for agents to be really educated on what the member needs to do in order to be auto enrolled into the Covered California plan. Now, first what happens is the enrollee is processed through the auto plan selection system. And Covered California is going to look at, does their Medi-Cal plan currently have a plan on the exchange? If the answer is yes, they will be auto selected to that plan. If they do not, they will be auto selected to the lowest priced silver tier. Now, next, Covered California is going to notify enrollees of a 90-day opt-in period, okay? Now, even if the member is not going to have a premium, so let's just say that based on the redetermination income information that was received, Covered California is going to send them a notice. It's going to say, based on the information you gave us, this is what your premium subsidies would be, right? So even if their premium is going to be zero, they still have to opt in. Okay, if they do not opt in, they're not going to continue with the auto enrollment process. Now, once the member opts in for the coverage, they're either going to choose LA Care if that's the lowest price silver tier, or they'll have another carrier. They'll have other carriers to choose from based on their region. Okay. Now, at that point, if a binder payment is required, they will be given 30 days in order to make that payment. And if they do not make the payment, then the enrollment is going to be voided. Now, in order for agents, if you have members that you helped with Medi-Cal enrollment through CalHears, and you're the agent of record, in order for you to remain the agent of record if they transition, they do have to opt in. Okay, so very important that you contact your members and you remind them they need to opt in, and if there's a premium required, then they need to make their premium. At that point, Covered California will send an 834 file to the health plans, and it'll have the agent of record information so that you can start getting commissions and renewals. Now, here's some of the correspondence that they're going to be receiving. So the first one will be like a welcome from Covered California. This is already sent after it's determined that the member does not qualify for Medi-Cal anymore. Okay. It'll give them their name, the carrier that's selected. So this will either be the lowest price silver, or it'll be whatever carrier they had for Medi-Cal if they're on the exchange. And then it's going to calculate what their advanced premium tax credit is. So then it would say, this is how much you would have to pay. It's very likely that it will be zero. This is just an example here. Now, they're also going to receive additional letters from Covered California letting them know that they do have other options. So if you see on that second notice, all the other carriers are at the bottom of that flyer, just to remind the members that they do have other options. Now, I do want to point out one particular nuance that was not mentioned earlier, and that's for mixed households. So what we see a lot is that parents are routed to Covered California during the enrollment process, and the children will sometimes go to Medi-Cal, depending on their income information. Now, once redetermination happens for the children, if they are found to no longer qualify for Medi-Cal and will be transitioned to Covered California, they're actually going to align and be transitioned to whatever plan the parents have. So it will retain that plan that's already with the parents. Now, this last letter here, that happens when they made no binder payment or they did not opt in. So basically what this is telling them is that the plan that was picked for them, it didn't go through. So the whole process was canceled because they didn't opt in. So as far as what LA Care is doing to educate those Medi-Cal members, we are sending flyers, regarding our community resource centers. We're sending postcards as reminders for them to make sure they go through the redetermination. We're also very active on social media, and we've even posted a YouTube video, really outlining the whole process and how somebody can go through that redetermination and how they can upload their information to the Medi-Cal Benefits Cal website. So somebody can do that on their own if they don't want to walk into DPSS. LA Care also put together a provider toolkit to educate our providers on the redetermination. So we already sent this to all of our medical groups, IPAs. So all of the providers should have access to this. It has a lot of FAQs and a lot of really great resources that they can pass on to their patients who are asking what to do. Now, these are just some of the enhancements that we've made on our website to help facilitate, information on this. So, we'll have information on DHCS, we'll have FAQs, and then we also have the number to the LA County DPSS. I do want to say that, as the agent of record, this is probably the last choice you want to give them is to call DPSS. There are other resources there to support them, which I'm going to mention right now. Now, this right here is a screenshot of what that dashboard is going to look like. Okay, when they log in, they're going to have the option to keep or cancel their plan. Now, this is what was selected for them by Covered California, depending on whether they're continuing from the same Medi-Cal carrier or the lowest price silver tier. It will give them the option to keep or cancel. If they keep, then that's opting in. If they cancel, they can still select a different plan and opt in that way just by selecting a different plan. Now, the you have options communication that it really just communicates they have, different choices. So if you see here on the enrollment dashboard, all the other carriers for that region are on there. They can change their plan. Or if we don't have the correct information on their household, whether it's income or they're adding on a different, family member, they can report a change. And then that will update the information that way as well. Now, this is what the household member section will look like. They can select to keep the plan for all the members or just some, or they can cancel for all the members as well. Other resources by the Covered California Service Center where members can opt in or out is via IVR. So there is call center IVR that's been updated to allow members that they can do it that way. So they will need to complete an authentication process. So it'll probably ask for personal information, such as social security number, date of birth. Once the system is able to verify that their identity is authenticated, it will allow them to opt in or out that way. Also, they can do it by the chat box. So if you go to Covered California website, Covered CA, then you could see that there's a chatbot, CC, and she can also verify as well. So she can authenticate the information, and then members can opt in that way as well. Now, this is two different scenarios. The one on the left is what it's going to look like if somebody is opting in and they have no premium. Then they just need to have their electronic signature and their PIN, their signature PIN. And if there's a payment required, it's going to pop up this screen right here where it's going to say that there's a payment required. Now, if they do not make the payment, keep in mind they still have that 30 days. So, they can always call the plan directly as well. But obviously, it's just a lot better if they do it right then and there, because then it's resolved and they're going to effectuate and you're going to be the agent of record. Now, another big change that I'm really happy and excited to share is that L.A. Care, in partnership with Blue Shield Promise Plan, we have contracted with community-based organizations throughout Los Angeles County to provide enrollment assistance and support at the community resource centers. So if you have members who don't want to go to DPSS, but they're pretty sure they still qualify, they just need some help completing the documents or uploading them to Medi-Cal, they can walk into any of our community resource centers, and we will have in-person support from community-based organizations there to help them with that. They are contracted and they are Medi-Cal assisters. Okay, now I've put here a location of all of our community resource centers in LA County. I will also make sure that everyone that's in attendance today is distributed a copy of all the locations that have the addresses and the hours of operation as well, in case you do want to send any members that way. This is also additional community-based organizations that are available in the community to provide either telephonic or in-person support. So this is based by region, and this is also another resource that I would like to distribute to the broker community, because I think it's very important that you're able to assist members, and sometimes referring them to Medi-Cal or DPSS is not really probably the best choice, because they may have some trouble navigating or seeing someone there. So I always refer to these community-based organizations. They've been doing this for a very long time, and they do help a lot of Medi-Cal beneficiaries. So this is where we need your help. As the broker community, we really need your help in educating the members. Keep in mind, like I mentioned earlier, if you enrolled somebody into Medi-Cal through CalHears, you will receive a notification on your dashboard if they do not qualify anymore. So if you have members on Medi-Cal and they submitted their redetermination documents and they were found by DPSS to no longer qualify, you will be able to see that on the dashboard. At that time, you should call them and make sure that they're able to transition successfully and opt in to that Covered California plan of their choice. Now, if they are still going to qualify for Medi-Cal, they'll still be on your dashboard. You're still going to be the agent of record, but it'll have them still qualified for Medi-Cal. So it will not say that they're no longer qualified. Now, in order to be on that 834 file, they have to opt in. So again, this is the perfect time to contact those members that you receive those notifications on and make sure they opt in. And if they have a binder payment to whatever plan they selected, make sure they make that as well. And at that point, you will start receiving commissions and renewals. And for those that are aware, LA Care, has the highest commissions in LA County. So that would be very beneficial for those of you who have Medi-Cal members that you were not getting paid on before, and now if they transition, you will. Okay, so at this time, I want to open it up for questions because I went through a lot of information and I know there may be some questions. So we can start taking questions now.
There are actually no questions
No?
at the moment.
Okay.
Sorry about that.
It's okay.
But we do encourage all the agents to send the questions using the Q&A box at the bottom of the screen. Not sure if is that the end of the presentation? Okay. Let me see. I think we have a question coming in. Okay, there's a question here. If there are any agent of record issues, what is the best way to get this resolved?
You can always contact Covered California if there's an issue with the delegation. You should be able to see whether you're delegated or not. But keep in mind, even if you are the agent of record on someone and they don't hear from you, it's always possible they may go to another agent and they'll get redelegated. So just to avoid that, contact your members. But if there is any specific issues on delegation, that would be directly through Covered California, not the carriers. One other thing that I do want to point out, this was actually a question that was asked in my last session. So I was asked, because I know a lot of you sell Medicare as well. I was asked, well, what about Medicare beneficiaries who want to enroll into Covered California if they don't qualify for Part A? They don't typically qualify for subsidies. So the answer to that is, if somebody is not qualified for Part A because they haven't worked the 40 quarters, and pay the 40 quarters in taxes, but they do qualify for Part B because they're 65, they can actually choose to drop that Part B. Okay, so they can decline the Part B. At that point, they will have no Medicare at all, and it will allow them to receive subsidies with Covered California. Reason for that is because anytime that the system recognizes that there's any kind of Medicare, you can't double dip on government, subsidies there. So you can't have both programs. So this is specifically for those that don't qualify for Part A. Okay. So for Part B, it's a little bit different because you're 65 and it's most likely they would qualify for Part B once they turn 65, but not necessarily Part A. So again, just a reminder for those that don't have Part A, but they're being offered Part B, they can decline it and become eligible for Covered California with subsidies.
Perfect. Thank you. We have another question.
Sure.
Can you explain the 90-day grace period? Can my client opt in and pay up to date if they don't notice for 3 months?
So it's actually a 60-day period through Medi-Cal that they will give them to, go through that redetermination, and then they'll have an additional 30 days to pay that premium. So it's a total of 90 days. And that will, for this first group that received redetermination notices in April, they will be given until the end of June.
Perfect. Thank you. Next question from Melissa. I might have missed this. For San Diego clients, do you know where they will be mapped? Parentheses, which carrier?
So it depends. For San Diego, I know there's various Medi-Cal managed care, plans. So it would depend. Now, I'm a little bit familiar with San Diego. So for example, if they're if they have Blue Shield, they're going to be mapped to Blue Shield. If they have Community Health Group, United, obviously they don't have a plan on the exchange. So they're going to go to the lowest price silver tier.
Perfect. This is not a question, just a comment from Ace. He or she said, wonderful information. Thank you. Anything else you would like to add, Jezabel? Thank you for that presentation, by the way.
You're welcome. No, I just wanted to thank everybody who joined us today. I'm always available for any questions that may come up after. I will be sharing a copy of this presentation as well as a couple of resources for the community-based organizations and also our community resource centers in case you want to distribute that to your members.
Wonderful. Thank you so much, Jezabel. This is Cristian Gallardo once again signing out. I want to thank all the agents that are in attendance today. And we will be assisting Jezabel in redistributing this information today. So have a great day and see you in the next iPros TV session.
Thanks, everyone.